Hello physios, I welcome you all to our channel Physio with David. We are back with our next lecture on cryotherapy or cold therapy. So after the physiological effects, we are going to study about the therapeutic effects. Okay, so these are very easy as we have a in-depth knowledge of physiological effects. So my name is Vijay Kumar and let's get started. The first therapeutic effect is recent injury. Okay, देखो, for example, you are playing in a ground, you were running, okay, so you got your ankle twisted. What will be the initial thing that will come in your mind? Yes, definitely it will be the application of cold. So जो recent injury है वहां पर हम most probably हम cold pack को ही यूज करते हैं. दैट मीन्स के रिसेंट इंजरी में जो कोल्ड पैक दैट इज क्रायोथेरेपी है उसका एक इमेंस इंपॉर्टेंस है. अब रिसेंट इंजरी दैट वाज द केस ऑफ एंकल स्प्रेन. ओके, सो वहां पर हमने कोल्ड पैक लगाया. व्हाट वर द रीजन बिहाइंड दैट? एज व्हेन वी आर सफरिंग फ्रॉम द एंकल स्प्रेन, ओके, सो द मसल so the pain will be initially the acute type of pain by the A delta fibers. So as we have studied in the physiological effect, that is the effect on peripheral nervous system, the NCV of A delta fiber is dramatically reduced. So definitely pain will be reduced. Okay, what else can happen? Your ankle can suffer from swelling. There also we can use cold pack, that is swelling will be reduced as it is discussed in the effect on metabolism, that is the permeability will be reduced, so edema will be reduced when combined with the compression and elevation. Okay, so this was the case in acute sprain, okay, on the ankle joint. And now for example we are having another case such as any trauma on our skin which has lead to bleeding. Okay, so bleeding हो रहा है, तब हम क्या करेंगे? Then also we apply the cold. Okay, so let me make it more easy for you. There are two conditions. There is boy A, boy B. Both of them are having injury, but the bleeding is different type. That is, A is having external bleeding due to any cut, but B is having internal bleeding such as hematoma. Okay, so there is hematoma in boy B. So what will be our initial step for their management? Both will be using cold bath, but the approach will be different. In the boy A, where bleeding was occurring externally, we will apply the cold pack, but we need to focus on some things, that here the cold application should not be of a prolonged time. Why so? Because when the bleeding is external, we want the bleeding to stop, and to stop the bleeding we need to make the activation of the clotting factors. So to increase the activity of the clotting factor, we need to have a good metabolism. But as the cold application reduces the metabolism, it can delay the activity of clotting factor. कि अगर हमने A में बहुत ज्यादा समय के लिए क्या किया, कोल्ड पैक यूज किया, तो उसकी ब्लीडिंग नहीं रुकेगी. क्यों? क्योंकि जो ब्लड क्लॉटिंग के फैक्टर हैं वो एक्टिवेट ही नहीं हुए. बट इन कॉन्ट्रास्ट इन द बॉय B, which was having a hematoma, that is a type of internal bleeding, here we can use cold for a much extended interval of time. Why so? Because we do not want any clotting to occur inside the vessels, because if clotting will occur inside the vessels, it can cause much more problems. So here our goal is to just reduce that hematoma with the prolonged application. So recent injuries such as sprain, okay, it reduce pain and edema. Then bleeding इंजरीज, वहां पर भी एक्सटर्नल, इंटरनल। इन एक्सटर्नल वी यूज इट फॉर लेस टाइम, but here we can use it for prolonged time. Prolonged time. Okay, so the effect is simply clear to us. So recent injury में क्या करना है वो आपको पता लगा कि कैसे हम क्रायोथेरेपी से थेराप्यूटिक इफेक्ट को ले रहे हैं. So this is about recent injury. Okay, so अगर तो एक्सटर्नल ब्लीडिंग है तो थोड़ा कम टाइम के लिए, और अगर इंटरनल ब्लीडिंग है वी कैन यूज इट फॉर प्रोलॉन्ग टाइम. एंड इफ देयर इज स्वेलिंग वी कैन यूज एलिवेशन along with compression, or simply you can write it as PRICE, which is prevention, rest, ice, compression and elevation to reduce the edema or swelling. Okay, let me just have another marker. Yes, this one is good. Okay, so our next point which I want to discuss is pain. Okay, so though I have written spasm here, but we need to study first of all about pain, that how pain is reduced. So in this condition we have already discussed the effect on peripheral nervous system. What was that? I had written A alpha here, then A beta, A gamma, then A delta, then B fiber and C fiber. So effect was maximum here, that is their NCV was reduced and the transmission of pain was reduced. And here pain is reduced by two mechanisms. First is the direct mechanism and second is the indirect mechanism. For example, this is the free nerve ending which was carrying the sensation of pain from spinal cord to the brain. Okay, so when you will apply cold pack in such situation, okay, these are the thermoreceptors. Okay, TR, these are the thermoreceptors. So what will happen according to pain gate theory? I have already discussed this thing in the in my previous lectures very clearly. Okay, so when we are applying cold pack, these thermoreceptors will be stimulated, which will give its sensation to the brain and block the nociceptive sensation. यानी कि जो फ्री नर्व एंडिंग पहले नोसिसेप्टिव इंफॉर्मेशन को स्पाइनल कॉर्ड से ब्रेन पर ले जाकर पेन को प्रिसीव कर रही थी, अब क्या होगा, वो थर्मो रिसेप्टर से कोल्ड की सेंसेशन को ऊपर लेके जाएगा और ये पाथवे जो ब्लॉक हो जाएगा, दैट इज क्लोजिंग ऑफ द पेन गेट. एक और तरीका, ये क्या था, डायरेक्ट मेथड. और अब इनडायरेक्ट में क्या होगा, इन द इनडायरेक्ट मेथड वी नीड टू अगेन मूव टुवर्ड द मेटाबॉलिज्म. उसमें क्या था कि जब भी इंजरी हुई वहां पर टॉक्सिन्स, एंजाइम, प्रोस्टाग्लैंडिन्स, ये सब चीजें क्या होंगी, प्रोड्यूस होंगी, दैट विल स्टिमुलेट दिस पेन नर्व एंडिंग्स, द नोसिसेप्टिव नर्व एंडिंग्स, और इससे क्या होगा, पेन होगा. लेकिन जब हम यहीं पर क्या करेंगे, कोल्ड एप्लीकेशन करेंगे, that is when cold pack is applied, what will happen here, the metabolism will be reduced, these enzyme and toxin production will be reduced, so definitely the irritation of nerve ending will be reduced, hence pain will be reduced. So the two mechanisms which are involved to block the pain are fully clear. First is that in normal condition when we are suffering from the pain, the fibers were carrying the pain sensation to brain, but when we applied the cold pack, what happened, it stimulate the thermoreceptor, that is the cold receptor, and its sensation reach to the brain, which block the previous pathway, hence pain is reduced. Second one is that the metabolism will be reduced when we are applying cold pack, so the release of toxin and other inflammatory mediators along with various enzymes will be reduced, which will not now irritate the free nerve endings, so pain will be reduced. Okay, so this was about pain. Now we are moving toward spasm. See, Pain and spasm are best friends. Pain, spasm. If there is pain, definitely there will be spasm, and if there is spasm, definitely there will be pain. It is having a vicious cycle. Okay, vicious cycle means that presence of one leads to production of other. If there is pain, then there will be spasm, and if there will be spasm, then there is pain. Now, as we have studied in this part, that pain is reduced. So if this pain will be reduced, so definitely spasm will be reduced. क्यों? क्योंकि पेन को रिड्यूस कर लिया तो स्पाज्म भी कम हो जाएगा. तुम है तो हम है, हम नहीं तो तुम भी नहीं. पेन था तो स्पाज्म था, और पेन को कैसे कम किया वो आप समझ चुके हो. तो पेन गया तो स्पाज्म भी जाएगा ही जाएगा. सो स्पाज्म को ट्रीट करने के लिए भी इट इज अ वेरी गुड मेथड टू यूज द cold pack, because this vicious cycle is broken by the application of cold, by reduction of pain, which is leading to reduction in the spasm. Okay, so इससे हमारा जो थर्ड थेराप्यूटिक इफेक्ट है वो भी क्लियर हो रहा है. फिर नेक्स्ट पॉइंट है spasticity. So what is spasticity? Spasticity is the abnormal increase in the muscle tone which is due to the upper motor neuron lesions. Okay, so now if we want to reduce this spasticity, we can reduce it by cold pack. But here we can have two effect of cold, that is inhibitory effect and facilitatory effect. And don't worry, you have studied this in the physiological effects. That is the effect on motor system. I have made you understand that if there is cold application of 5 minutes or less, muscle strength was increasing, that is contraction was increasing, that is tone was increasing. And why it was increasing? Due to the stimulation of alpha motor neuron. From where? From the alpha motor neuron pool. That is the excitatory effect or the facilitatory effect. यानी कि कोल्ड पैक को हम टोन बढ़ाने के लिए यूज कर सकते हैं. Yes, definitely we can use, as we have studied in the physiological effect. और यहाँ पर अगर हम स्पास्टिसिटी की इंडिविजुअली बात करें कि जहां पर स्पास्टिसिटी है तब क्या है, मसल की टोन बढ़ी हुई है, मसल कॉन्ट्रैक्टेड स्टेज में रह रहा है. सो डेफिनेटली वी विल बी ट्राइंग टू रिड्यूस दैट. तब हम क्या करेंगे? कोल्ड एप्लीकेशन 30 मिनट और मोर. What was the effect? It was reduced muscle contraction, that is reduced muscle tone. So definitely spasticity will be reduced. Why it will be reducing? Because of increased decrease in the NCV, increase in joint stiffness, reduction in the blood flow. So that were some explanation that how inhibitory effect was working. So we can use either to increase tone or decrease tone. So in facilitatory effect, we were using it for 5 minutes, which was increasing the muscle tone. But here we were using 30 minutes or more, here less than 5 minutes or 5 to decrease muscle tone. Okay, so to decrease the muscle tone and hence to decrease the spasticity. Okay, various studies have shown positive effects of cold on reduction in the spasticity. Okay, and this can also be used in multiple sclerosis. Okay, in some books there is another therapeutic effect, that is effect on multiple sclerosis. In multiple sclerosis, when we were using hot pack or the climate is itself very warm, then there was a very bad effect on the individual. But when we are using the cooling, spasticity was reduced. Hence you have a good explanation that how spasticity is treated. Okay, now this thing is again important, that is muscle strengthening. Can we use it in muscle strengthening? You will say that yes sir, if we will be using it for less than 5 minutes, definitely it will increase the muscle contraction. so muscle strength will be increased. But if we are again using it for the longer interval of time, it will reduce the muscle strength, as we have studied it in effect on motor system. See, there are two ways of studying. In my previous lectures, in which we have studied the basic things, okay, my basis of electrotherapy, basis of exercise therapy, then TENS, pain gate mechanism, I have used a lot of theory in that. Okay, so there must be some students who were saying that there is a lot of theory in your lecture, but it was very important. Now you can understand that how less things I am writing on the board. Why? Because you have a basic understanding. Here also, what you are writing? You are writing that how the pain gate theory is working, simple, which you have already studied. So there is no need to write any kind of theory. Here also you have already studied the physiological effect on motor system. So no need to write. So initially when we are making our base, we need to have an in-depth knowledge of theory also. But after that we can make it very easy for you, so as you to understand the whole things. ओके, सो मसल स्ट्रेंथनिंग में भी हम अगर कम टाइम के लिए यूज करें तब क्या होगा, जो अच्छी स्ट्रेंथनिंग होगी. फॉर एग्जांपल वी आर यूजिंग आइस स्ट्रोकिंग आल्सो. सो ये था मोटर स्ट्रेंथनिंग. और स्ट्रेंथनिंग में आप एक और पॉइंट ऐड कर सकते हैं, दैट वाज जीबीएस. कि मैंने आपको कहा था कल पिछले लेक्चर में कि द कोल्ड व्हेन अप्लाइड टू द इंटैक्ट नर्व फाइबर. मैंने यहाँ पर आइस पैक लगाने की एग्जांपल दी थी कि मैं नॉर्मल इंडिविजुअल हूं, मैंने यहाँ पर कोल्ड पैक लगाया तो मेरा यहाँ पर कंडक्शन ब्लॉक हो जाएगा. ओके, बट इफ द सेम थिंग इज डन इन दैट पैथोलॉजीज which leads to demyelination of nerve, as in Guillain-Barré syndrome, there the effect was positive, that is conduction was increasing so as to increase the strength. Okay, so GBS में क्या होता है, जो हमारे peripheral joints है, for example at ankle joint, okay, the dorsiflexion is dramatically reduced, so we use ice stroking to increase the conduction and further to increase the strength. वहां पर ये दोनों चीजें, that is effect on peripheral nervous system, जहां पर हमने demyelinated nerve को stimulate करके क्या किया, कंडक्शन को बढ़ाया. ऑल्सो मोटर सिस्टम में भी क्या इफेक्ट पड़ा, दैट इज मसल स्ट्रेंथनिंग पे, कि जो वो आइसिंग थी वो 5 से कम मिनट की थी और उससे क्या हुआ, एक स्ट्रेंथ बिल्ट होगी. सो डॉर्सिफ्लेक्सर्स विल बी वर्किंग नाउ. दिस वाज अबाउट मसल स्ट्रेंथनिंग. नेक्स्ट इज अबाउट एडिमा एंड जॉइंट एफ्यूजन. ओके, क्रायोथेरेपी इज वेरी vigorously used to reduce both the things. In case of acute edema, definitely we will be using acute edema, we can use it. Okay, in case of chronic edema, it depend further on the type of edema. For example, मैंने रिसेंट इंजरी पे क्या बोला था कि एडिमा होगा, तो उसमें हम यूज कर सकते हैं, देयर इज नो प्रॉब्लम. बट इन केस ऑफ क्रॉनिक एडिमा वी नीड टू फर्स्ट अंडरस्टैंड व्हाट टाइप ऑफ एडिमा इज इट. दैट इज ईदर इट इज ड्यू टू इंक्रीज्ड वेस्कुलर परमिएबिलिटी और ड्यू टू ऑब्स्ट्रक्शन एज इन डीप वेन थ्रोम्बोसिस. डीप वेन थ्रोम्बोसिस दोनों में अब क्या डिफरेंस है. अगर तो ये एडिमा जो क्रॉनिक है, इट इज ड्यू टू द परमेबिलिटी, वी कैन यूज इट, वी कैन यूज द कोल्ड पैक. दैट इज एज वी हैव स्टडीड इन द मेटाबॉलिक इफेक्ट, वेस्कुलर परमेबिलिटी विल बी रिड्यूस्ड, डेफिनेटली एडिमा विल गो. बट इफ इट इज ड्यू टू ऑब्स्ट्रक्टिव लीजन, दैट इज सच एज डीवीटी, वी विल नॉट यूज कोल्ड पैक. व्हाई? Because in DVT, that is deep vein thrombosis, there is already an obstruction to the blood flow, that is there is a thrombus formation, and if we will further apply the cold pack, there will be again vasoconstriction which will further reduce the blood flow, and instead of giving us a benefit, it will cause a very bad effect, that is a detrimental effect on the patient. Okay, so first identify the cause of edema. Okay, so this is about chronic edema and joint effusion. Okay, so you can add hematoma point here also, that if there is hematoma we can use the cold pack for a extended interval of time, because and hematoma is an internal bleeding and we do not want any clotting, so there is nothing to worry about the timing. You can apply it for 20 minutes also. Okay, so this is about edema and joint effusion. Okay, so in hematoma I recently had a personal injury. I was playing cricket. Okay, so I was not wearing pads, we were playing with leather ball. Okay, so my friend balled me and it hit me on the shin bone, so I have a good hematoma at that site, and I applied, even in the 5 to 10 minutes I applied the cold pack for 20-25 minutes, and there was drastic reduction in that hematoma. And I was thinking that if I did not apply that cold pack, it would be a big hematoma, so it is very good. So you can also write about hematoma here. Okay, last is chronic inflammation. See, effect on acute inflammation is already discussed. Why? Pain is reduced? Yes. How pain is reduced? You have already studied, that is the effect on the peripheral nervous system, these nerve fiber. Okay, in acute inflammation, does edema is reduced? Yes, edema is reduced. So these are the two main goals in acute inflammation. But in case of chronic inflammation, does pain was improving? No. Why? Because the chronic pain was taken by the C fibers, which were having minimal effect. So in chronic inflammation, the pain is not reduced by application of cold, but edema. Can edema be reduced? Yes, definitely, except the edema due to obstructive disease, that is the DVT. So edema भी कम हो सकता है. Then chronic condition में what are the further goals? Muscle strengthening. Yes, definitely it can be increased, as we have studied in the previous therapeutic effect, that is less than 5 times we can give strokings to increase the muscle strength. Okay, range of motion will be further increased. Okay, so chronic condition में वैसे तो हम अदर ट्रीटमेंट्स के ऊपर ज्यादा रिलाई करते हैं, लेकिन एडिमा एंड मसल स्ट्रेंथ फिर भी एक अच्छा रिस्पांस हमें देंगे, जिससे क्या होगा, हमारा जो कंडीशन है वो ठीक हो जाएगा. सो स्ट्रेंथ, एडिमा, रेंज ऑफ मोशन, ये सब चीजें जो है ठीक हो जाती हैं बाय द एप्लीकेशन ऑफ कोल्ड. ओके, सो विद दिस वी आर कंप्लीटिंग द therapeutic effect of cryotherapy. So you can add one more thing that I have discussed in the previous lectures, that as many studies had found that cold application reduces the tremors. So I had explained that in Parkinson disease, in Alzheimer disease, it is also used to reduce the tremor. You can add that point also, okay, which is good to have a extra point for your theory exams. And for Viva, I have explained you each and everything along with their reasons. Okay, so now in our next lecture we will move toward the further part of cryotherapy. So till then, you keep on studying. Thank you to one and all.